Banish the Thinker, Part 3, an epistolary dialogue between Jameson Alex West and Richard Taylor. 7th of the 11th, 2020. Hi Jameson, I've read your essays. Overall, I like the idea of them. I think you should do more. I might only recommend against making generalizations about countries, but I could be wrong. Ari, my eyelight. I seem to find endless things to distract me, but the post I have up is the last one. In a conceptual sense, it doesn't end. I need to add to the post up there now, but there is another blog associated with eyelight. I call it the control blog, and I want to put up events regarding friends I knew who have died and stories about places I worked and reviews. Meanwhile, I read a lot and watch videos from the library, often ones based on a novel or something. My son Victor has taken to writing poetry and reading about it and lit, which is good, as he has had times of depression which have lifted a bit. We both now go to the poetry live and read. It is kind of therapeutic. We don't drink. In the old days, when I read, I used to drink a lot. And coming home sober is great. Keep in touch. All the best. Keep writing those essays. Richard. 19th of the 11th, 2020. Hi Richard. I'm almost done with renovations. How's the writing? I have decided to split my anthology into fiction and non-fiction sections. Smaller books, pickier readers, a broader portfolio. We are in medium-level lockdown here in Oslo. Alexandra showed me an NZ Herald article about wearing masks on public transport, with a caption, "Have you seen people flaunting mask regulations? Send us your photos." We are looking at coming back so my parents can see their grandson and I can market these 2 books. Not sure how that will go. But trying to figure out if it is all worth it. I hate masks. They give me headaches and I'm dubious about the effectiveness of paper ones. But I have to respect others' wishes and fears, so I don't use public transport in peak times or go to shops and restaurants. My choices are to break the law, isolate, or wear one of these dehumanizing face leeches, so I pick the middle option. It isn't a bad time to be a writer. I viewed eyelight and see there haven't been any editions for a while. How do I access the control blog? How wonderful it is that Victor is writing. I know very few people writing, and no men. If he wants sample readers, I'd love to take a look. Alexandra as well. There's always fear in my mind that she'll die prematurely due to her heart condition. But that's just what getting older is about. I turned 40 the other day and don't see the fuss. I'd rather strive for wisdom than attempt to maintain youth. Although for a writer, I am still relatively young. Unfortunately, Alexandra's mother has been diagnosed with COVID-19 in Scotland, but she's doing well. She's a tough, no-nonsense Polish woman. I'm reading The Makioka Sisters by Junichiro Tanizaki, about a Japanese bachelorette unable to find love due to personal high standards and Japanese puritanism. I do find many congruencies with perfectionist women I know, who have impeccable expectations and a dating biological clock. It is sad to see. I still want to read your book. Do you have a PDF? I can pay for it. Regards, Jameson. 22nd of the 11th, 2020. Hi Richard. To be fair, I don't really know too much about COVID-19. I do know that New Zealanders in general trust their government far too much. I also know that wearing masks makes people look like they care, but it is worthless cause when nightclubs and bars are operating as per normal. People may be aware of social distancing before drinking, but once intoxicated, sweat, toilets, shared drinks, touching, hugging, dancing, kissing. It's much more dangerous than half-empty buses where people are often able to keep 1.5 meters of distance. The polio vaccine is good, I agree, but I don't agree that all vaccines are good. You're probably right regarding long-term damage with a virus, but I don't think anybody really knows. Media speculation is out of control. Some governments are over-reporting numbers for political purposes, while others are under-reporting them for economic purposes. Alexandra's mother suffered little. She had sore joints and flu-like symptoms. She is back at work. Depression, paranoid episodes, and suicides are on the rise, and there is little from the mainstream media encouraging people to take on healthy diets, meditate, exercise, read, etc. That doesn't make media or governments money. So much speculation about health, yet people still binge drink, overwork, and take methamphetamine. According to the Ministry of Health, health.gov.nz, 30.8% of New Zealanders are obese. I don't understand the sacrifices made to cancel out one virus, our bodies carry many, with such poor education and health. Life is risk. We will all die. I am not worried about death. The only thing that worries me is that my son would grow up without his father. And yet, once, and if, COVID-19 disappears, there are still strokes, heart disease, aneurysms, civil wars, international war, pneumonia, multiple sclerosis, Alzheimer's, suicide, murder, car crashes, cancer, dementia, famine, natural disasters, climate change, workplace accidents, meningitis, drug overdoses. These things seem to have been forgotten. I don't mind Jacinda Ardern. I voted for her in 2017. I voted a minor party this time, and I think she'd make a better leader than her opposition, but I was not compliant with her orders. I admit that I continued to work during lockdown, only 2 of us on site where we maintain distance. I continued to swim, even though it was illegal. I haven't drowned yet. And I continued to post books, despite them being banned, unlike gaming consoles or refrigerators. I dedicated my first book to a Polish poet who had been living in Australia since 1963. She died alone during the Melbourne lockdown. Her name is Anya Volvich. Have you heard of her? The last time I saw her, she suggested I write about her. The virus broke out, and she proclaimed the world would see authoritarianism equaling the mental oppression of the Third Reich and early Soviet regimes. When I wrote to her with an outline of my plan asking permission, she rejected it, and then she died. Jameson. 24th of the 11th, 2020. Hi, Jameson. RE the governments. It's a question of practicality. I think you can trust the NZ government on health and some other issues. To a large extent, the Chinese can also be trusted in that their medical scientists work well with the best scientists in the US and NZ, but it is true that science has been misused. Overall, NZ and a few other countries handled the pandemic pretty well. The US could have done as their FADC and other medical institutions are there. It was a mistake for Trump to separate from the World Health Organization. Masks and distancing are essential to stopping the pandemic. So is quarantining, which has been done since the 1300s. The US, for example, needs to lock down completely until vaccinations have been developed. The vaccinations will work, but it will take time. Nightclubs, bars, and restaurants in such countries where there is significant viral infection need to be closed until they get vaccines as well. This could well be another year or at least 6 months. For the individual, I advise wearing masks, hand washing, and maintaining distance and regular testing. SARS-CoV-2 is a disease that attacks the lungs and is a terrible thing to get. However, the body is always fighting incoming viruses, bacteria, and fungi. It also sometimes attacks itself. This can be severe or mild. With the virus, the symptoms also include blood clots, which can lead to strokes and sudden death, malaise, and long-term depression. With Trump out of the way, if this can be done, the medical people can get onto preventing a large number of deaths and distributing the vaccines. I have never liked touching people or kissing women or anyone as I feel it is dangerous. Sounds strange, but I don't even like shaking hands. If I do, I wash my hands as soon as possible in every case. I have done this for years. I am meticulous with hygiene, and I don't like pubs or nightclubs. I go to Poetry Live, but try to avoid any physical contact. I also go to a chess club. People need to maintain hygiene, but also avoid alcohol altogether, as it is a poison, and also any non-prescribed medications. Weight is a concern. It is important to keep one's weight within the recommended limits. I try to do this. I also take vitamins, such as the B group, including B12, and I eat quite a lot of fruit. I don't drink alcohol. I am fortunate in that I can avoid public transport. If I had to use it, I would certainly wear a mask. Those do protect as long as they are worn properly. I don't like them, but I know they are needed where the infection is a big problem in Europe, the US, and even potentially in NZ. But there are other things such as the common cold that one is protected against, and some other quite dangerous diseases, regardless of or in addition to SARS-CoV-2. The media are not a reliable information source. The people I look to include the TWIV group, a group of virologists, immunologists, geneticists, and others. They have been discussing virology and related fields for years. Also useful are YouTubes by doctors and scientists working in acute hospitals and lectures on virology and cell biology. Technical terms can be looked up quickly, and there are also scientific papers that can be read. All this said, there is a natural suspicion of governments and scientists for historical and other reasons, which would get me a long way into philosophy, epistemology, etc., and political and social theory. And in the end, the fate of all these things is in the hands of the people. But numbers are mostly underreported. The reason is that, if we are talking about the number of infections, many people don't go to a doctor or take a test, and a large proportion of the population has no symptoms but is infected. These can only be detected by random or other tests, but if a person feels well, they won't normally get a test. Medical scientists do encourage good diets and watching weight, etc. The media are not really there to instruct us. Some are good, and you need to bypass the mainstream media and the trivia and find substantial information. They know that older people and people with preconditions, such as sleep apnea, obesity, high blood pressure, and some immune-compromised diseases, are at risk, so they encourage work in that area. Mental health issues are a constant, I think, and are probably proportional to the economic conditions overall. According to Johann Norberg's book, Progress, RE, 10 Parameters, all of them have improved since 1200 CE. Before that, statistics mean nothing in my view. We can't analyze how happy people are or what their quality of life is. Norberg analyzes 10 parameters but avoids the question of what defines general human progress. This would be a very big book. But overall, most things, such as longevity, nutrition, hygiene, the extent and casualties of wars, homicide levels per 100,000, and even pollution have improved. He maintains that the belief things are getting worse is constantly reinforced by the reporting of news media, who always print the worst things, whereas most things have greatly improved and are still improving. Of course, there are complex issues that he does not address, but if his stats are right, we have improved in many ways. Short-term fluctuations are a factor. The viruses in our bodies mostly do no harm, nor do bacteria. This is because our immune systems, complex as they are, keep a balance. We will only control the virus, not eliminate it per se. We have to find some way to help our immune systems. If humans survive the next 200 years, this might be one of the challenges we can look at working on. But as to my deeper philosophy, I won't go into that here, as I would need to write a book-length email. For now, we need to follow the models as long as they work. But knowing things is another thing. This part of philosophy leads into my hobby horse of epistemology, and the impossibility of absolute knowledge. But I hope all goes well for you and your family, Jameson. I'll get a book to you as soon as possible. All the best, Richard. 2nd of the 12th, 2020. Hi, Richard. The New Zealand government has little to do with my life, although they mightn't allow me to return to my country of birth. I'm not married, and Alexandra doesn't hold New Zealand citizenship. I may have to upset my parents, for I cannot take Alexandra's son away from her. Pre-COVID, it was easy to go to Poland or Scotland, where her father and mother live. It was never easy with New Zealand, though as they say, the tyranny of distance didn't stop the cavalier. Things change. I neither trust Trump nor the WHO. I'm not sure why I should. When you say, with Trump out of the way, do you think there will be a largely positive change in the US that will influence the rest of the world? I don't. I'm not against touching people. I enjoy the intimacy of greetings from those in Southern Europe and South America. Touch is trust. Yet it is these nations of hugs and kisses that have high infection rates. So I have refrained, and one would hope the locals are putting their social cues on hold. I'm not sure that they are. I don't eat too much. I jog and stretch. I was training with a rugby league team, but the authorities cancelled training due to the pandemic. I'm not sure I agree with you that people need to avoid alcohol altogether. I follow Norwegian law on public transport. I do not wear a mask if I am distanced by 2 meters. Otherwise, I get headaches, and I enjoy having a face and seeing others. I also respect their fares. People use masks for one trip. The train tracks, bins, and drains are overflowing with these polypropylene blues and whites. And where will they end up? Will humans die out in the next 200 years? If they do so out of my direct action, it's a problem. If they cease to exist from something I cannot control, it makes no difference to me. Cheers, Jameson. 3rd of the 12th, 2020. Hi, Jameson. The pandemic has affected millions, but it is less severe than any other such in history. This is because of the enormous advances in medical methods, and since we have a United Nations, which did not exist once. I am also skeptical of politicians, but I think we were lucky to have Ardern when the pandemic struck. As to Trump, he is amusing in some ways, but he is not a nice person, and although I'm not starry-eyed about the Democrats, I think it is necessary at this point to get rid of him and also some of the Republicans who back him. The US is verging on civil war. The point about the systematic approach to the situation is that the death rate and illness amount due to many other diseases is very much reduced since people started washing their hands more, taking flu jabs, keeping distance, and masking when appropriate. This means that thousands fewer people have died from various viral diseases, and probably bacterial also. The vaccines have been developed very quickly, far more quickly than any others in the past. That is incredibly good science. The situation now is difficult everywhere, but less so than, say, what my father had to face in the late 20s and 30s. Then he had to join a work camp and cut gorse like thousands of others in New Zealand, and the effect of the Great Depression was enormous. Fortunately, Roosevelt and later the Labour government here brought in reforms, welfare systems, and credit. Then they all went through World War II. In 1918, the Spanish flu, which like the coronavirus attacks the lungs and causes, among other things, severe pneumonia, killed millions, possibly as many as 10 million worldwide. These things are always underreported as so many were dying, and the medical people died trying to save lives, as they are now. As to the US, they do need a more rational leader. But of course, we need this rationality to extend beyond the pandemic into many other areas. Unfortunately, science is also used by the various militaries for things that are not so good. In terms of trust, though, That is always a matter of judgment. We are always limited in what we can know of anything. Nevertheless, I think overall we are better off now than at any time in the past. The environment is problematic, but we can adapt with some luck. Some things simply require luck and good management. I just have a few reservations about being where there are too many people, but my son and I go to the pub to read poetry. The thirsty dog. He has to get home early, and I am not too interested in boozing as in the good old days, when I drank and used to go all over the place. This was from about 1989 to 2000 or so. A few years after that, I realized I needed to lose weight and rein in my drinking. I had started as it enabled me to get the courage to read. Nowadays, though, I can read without drinking. I just drink water or Diet Coke, as does my son, for medication he takes interferes with booze. I understand this situation. This pandemic is frustrating, but it is something we have to live through as people in England lived through the Blitz and Germans and Japanese through firebombs and later the Vietnamese, etc. We have mainly small wars, and the attrition from them is less. I don't believe in progress per se, but Johan Norberg convinced me on some parameters and stats he gave in his book Progress. He is Norwegian or Norwegian born. Regarding long-term survival, there are no guarantees. Other species have been wiped out by extraordinary events. Technically, by the way, we are in the middle of, or beginning of, an ice age. But human creation of pollutants may cause a serious change. The causes of climate change are not fully understood according to a book I am reading. It is oldish, but the writer, a geographer called Brian John, is still around. The book is called The Winters of the World, The Earth Under the Ice Ages. I wanted to read through a selection of books old and new on my bookshelf. In this case, I am reading all the books. I mean of those I select. I have too many to read all of them. My other project involved going through the Dewey numbers at my local library, starting at 000 to 999 at each section. I would take some books, forcing myself especially to read what I didn't like and allowing some I did. My idea was to gather data. I went through every conceivable kind of book, including romance, children's, newspapers and magazines, sports, photography, sociology, science, biography, religion, and in languages I couldn't understand. What I did was to take samples. Then at about 4 places in each book I would spin a pen. Where the pen pointed, I would select something and write anything out. I might write more or less. In some cases, I became fascinated by the actual story, but I was really looking for differences and the way people wrote. This meant I was building my own databank, so to speak, for what I call the Infinite Project. I debated whether I should have got a tablet, but as for some years now, I have been writing by hand. I have about 30 books full of quotes from books I read, mostly library books, but sometimes my own books. The Dewey Decimal Project, though, was also like going on a journey. I also like reading dictionaries and technical books, even if I don't understand them. But there are different categories of reading game I was involved in. Books that caught my attention and kind of forced me to read them included one about a young woman who ran a rescue service for hummingbirds in the US. Remember, I was not picking good books, so if I randomly picked up a book by a white supremacist, I would take notes, and I took notes of events from a book by a British soldier in Ireland, but none of the books disturbed me. Also, a description of tsunami where a woman escaped but lost her whole family, including her children and husband. Alvarez, the poet who wrote The Savage God about suicide, which I have read in part, he knew Sylvia Plath and is in his 80s, was somehow hypnotically fascinating, so I took a lot of notes. Against pain of age, he forced himself to swim every day, cold or not, and kept a diary. There was a book about a woman who climbed to the highest place in Britain, the lowest, and so on, and nearly drowned. I read all of it. There were strange books about weird cars, one about an Olympic gold medalist woman who suffered depression despite winning, a book about a terrible Australian jail, a book in Chinese, one in hieroglyphics, I found the language in books about computers fascinating. A book about a doctor, written by his son, with a syndrome that caused him to go into really strange rages, tear off all his clothes, and so on, whose wife left him, and who tried desperately to reunite with her, but in the end committed suicide. Finally, there was a book by or told by a 90-year-old woman from Nepal who never wore shoes or went to school or hospital, was married into a family at a very young age, lived a harsh life, but outlived her husband and built up a community on the plains. By using stones as a computing system, she paid off her husband's gambling debts and modified her house. As she gradually became more prosperous, she sent her daughters to school. She herself didn't believe in the new ways, but she wanted her daughters to learn. It was translated by her daughter from what she had told some New Zealand social workers, I think they were. But mainly my project was a search for words and phrases, not stories. But I allowed for these to happen. So in a sense, you are seeing that my writing is to a large extent my reading. Whether it is the process of reading and literally copying by hand, the adventure for me is into language and ideas, and sometimes these things come or will come subconsciously, and in other cases I have or will use them or fragments of them, or mixes of them in my infinite project. This is more or less what I have been doing on iLight. This is a diversion, I know, but I do these things. I take what you are saying. I also see those masks discarded. Getting back to your points, I can see that it is easier for me to advocate staying inside and not socializing and/or drinking, as I am quite old. I am not advocating it though because I fear death. Of course I don't want to get ill, and I will take flu jabs, etc. I seem to be in reasonable health. Touch wood. Of course, young people always want to socialize and we need our families. But despite the pandemic being a nuisance, to say the least, it is also interesting. Whether we survive or not, we can think of ourselves as being in a novel by J.G. Ballard, say, The Drowned World. There are many views of things and, of course, a discontent with governments, as there should be. Kind regards, Richard. Richard Taylor's iLight project can be found at richardinfotex@blogspot.com, and his book, Conversation with a Stone, is available for purchase as an electronic book at kobo.com, bookdepository.com, and titusbooks.co.nz. Victor Taylor's work can be accessed at facebook.com/groups/poetry.org.nz.